Hello, I'm Allan Stalvey of the South Carolina Hospital Association, and I'm pleased to welcome you to our very first Capitol Beat, a brief video that we will produce periodically during the upcoming legislative session. Of course, we will continue to send out our weekly legislative report, The Pulse, to update you on all of the legislative issues we're following. Although several hundred bills have already been introduced, most of the backroom conversation centers on the budget and redistricting. But the State House will really come alive tomorrow as the 119th General Assembly convenes the first of its two-year legislative session. Clearly, your association will focus on the budget, and especially the funds that will be devoted to our state Medicaid program. Soon, the House Ways and Means Committee will begin developing a state budget for the fiscal year that will begin in July of this year. The committee will begin the process with $800 million to $1 billion less revenue than they need to maintain state government services at their current levels and meet statutorily required increases in other areas. For the Medicaid budget, Health and Human Services is requesting a $663 million increase over the current year's budget. Obviously, given the state's dismal economic condition, that request represents a huge gap between what is needed and what we can expect. The Hospital Association has been working with members from across the state to develop recommendations on how best to address this funding shortage. Our goal is to minimize the disruption to patients, the healthcare system, and our state's economy. We will be sharing those recommendations with all of our grassroots advocates so you can talk with your elected representatives about them. Please understand that as a member of LEAD, SCHA's grassroots organization, you are a critical part of our total advocacy effort. Our effectiveness at discussing these issues with the legislators at the State House is directly proportional to the involvement you choose to have in the process. I encourage you to double and triple your efforts to get a clear message to policymakers that funding health care adequately is critical to our state's economic well-being and quality of life. Thank you for sharing your time with us today, and with your help, we look forward to an exciting and rewarding 2011 legislative session.